Well, good evening, everyone. This is August 1st, 2023, and I'm Dr. Ellithorpe with Tustin Longevity Center. We here are a group of 8 healthcare providers now, and we are growing. We are helping each other and our patients to grow in knowledge of the integrative functional approach to healthcare, from gut health to mood to physical, and now we're looking at adding some natural counseling as well, and that will be announced soon. So we're always looking for ways to reach out to our patient base, their friends, their family, and provide for you all access to a more conservative, practical approach to practicing medicine. We will, of course, use prescription medicines and surgical and imaging as appropriate, but we're trying to keep you healthy. We're trying to restore health, and we're trying to use the least amount of medicines, if none possible. And that is what we stand for here at Tustin Longevity Center. So welcome. This is done on every Tuesday at 6 o'clock. We're sorry for the some kind of a technical problem last week. I don't know what happened. It could have been me. I might have hit a button that was wrong. But I'm learning how to use this machinery. So what I have are the questions, the emails. You can email us your questions if you are a subscriber to our tlcdoctors.com. You can get on an email list, and then we can give you notifications, updates when we're doing our YouTube channels. And there on that update is a link on the email that you can literally click just to type in your email questions. With that, it's handed to me, and these were handed to me last week, right before the show, which is normally we wait as long as we can to be able to download them and make them available for our 6 o'clock show. Therefore, I'm going to go over these because I want to cover them. We didn't take any new questions today because I can't do 2 nights worth in one evening. And then if you have chat, you can type it into the chat here on the YouTube, and I'll try and capture that as well. So we'll go from the live YouTube, and then we'll work on the emails, and then we'll get back on a roll. Maybe next week we'll be in our new YouTube studio. We have new and improved video wear and lighting and backdrop and sound, so that we don't have to use my office and my desk. Well, with that, so we welcome you tonight. We welcome your questions. No question is foolish, and even if we repeat questions, we can learn over and over again. And I learn from my patients. They drop off information, articles. They send me links to videos they feel are important. I'll do as best as I can to try and look into each of these, but we learn from one another, and to be a doctor is to be a continual learner. So let's begin with last week's first question that we had. I have 4 pages. The first one came from Harlow, and she asked me, what do you consider high blood pressure? I usually run 140s over 75/80. Is this considered high? I have been taking clonidine 1 milligram, but after 4 to 6 hours, my blood pressure goes up to the 140s. I feel more comfortable when I'm in the 120s, 30s. So the cardiologist prescribed diltiazem, slow release, 120 milligrams, but it gave me migraines for 3 days, so I stopped it. I'm really nervous about taking these meds, and I'm wondering if I really need to keep trying others. Which blood pressure medication do you recommend as the best? My heart is fine. My issue is more of anxiety and stress that trigger it. Thank you for your advice. It's highly respected. In general, blood pressures that are 140 over 90 diastolic bottom number are considered a point at which the patient and the physician should be looking at treatment. Now, very often, most high blood pressure is called idiopathic or essential hypertension, which means we don't know the cause. And that's the vast majority. But indeed, the degree of heart disease and high blood pressure, in fact, all cardiovascular disease, but hypertension has been climbing. And we're going to put the finger on our lifestyle, and in particular, a group of issues. Number one would be the sugars, too many sugars, too many starches, too many fruit sugars, too much drinking of sugar and smoothies and juicings that we're making, and lack of exercise, a regular form of exercise. We should be understanding that the body needs to move. And if you are eating too many sugars and we're moving less as a people, we are going to gain weight. So obesity is a growing problem even into the children's health today. So carbohydrates, lack of motion, lack of hydration, lack of good night's sleep. And yes, we have concerns, stress, news, world affairs. But you need to find that which grounds you. For me, it's my Bible here, and I read 4 chapters every day of my life. And that is the piece that I know I can focus on doing what I can do where I'm at. I can't change people, only God can do that. But I can be steady, I can be at peace, and I can focus and get my relaxation from that. If you don't have a faith or a faith that you're practicing with, you'll need to find something in the form of exercise or meditation, deep breathing. Even deep breathing will bring up the parasympathetic rest and relax and digest phase, which is brought on by deep breathing and then holding it a few seconds and slowly letting it out. Just that fact will often cause blood pressure to decrease. A long walk, getting involved in hobbies and the like. So I would say that if you could learn to eat only real food, stay away from processed foods, this would be the direction to go, nothing from a package. And start a commitment to what you'll do, being resolved that you will do this or that, and a resolution that I will begin exercising 5 minutes every morning before I allow myself my first cup of coffee, or whatever rule you're going to give yourself. Make it easy and attainable. And I will often say, after you wake up and use the bathroom, before you do anything else, you can start doing some marching in place. Then for 30 seconds, sit on the floor, do 5 sit-ups or tummy crunches, roll over onto your knees, do 5 push-ups from the knee if you can't do it from your toes, stand up, march in place 5 minutes. Everything helps for motion. If you're at work and you have a seated job, if you can get a desk that raises, I would break from your desk, even have a little timer on your phone that'll give a little sound bell ring, just to help you to stop, walk around the office, a minute. This motion is quite essential. And as far as prescriptions, the old-time prescriptions are usually in the form of things like beta blockers and angiotensin receptor inhibitors like lisinopril and ACE2 inhibitors. And then you get into the calcium channel blockers. I don't like the diuretics. I've never felt diuretics are the proper thing. I do believe that most of the water, or good studies recently have been showing, the more excess sugar you have, you're holding on to 2 extra water molecules that are closely associated with each glucose, fructose, galactose molecule in your body. So even people who start the carnivore diet very often will have a water weight loss, a initial jump start of like 5 pounds the first week. So we are not afraid of salt. We don't believe salt at all is the problem with the diet in the vast majority of cases. There are isolated specific cases where you do have to watch this. But we believe that if you get into lifestyle commitment with your exercise, with your going to sleep, your sleep hygiene, shutting the lights off, getting your phone and electrics away from you, and then having a motion or a commitment to some motion every day, regular exercise, setting out at least one extra glass to make sure you consume, setting little rules for yourself, and be proud of yourself for that. That's how we look at taking care of blood pressure. Um, let's begin and do that. And I hope, Harlow, that you can do those things. I always try and do at 140/90 lifestyle changes first. When I start seeing it consistently climbing up to the 150s, 160s, I request that my patients start medicines. And even if they're trying to do these other things, once we've cleared other causes and we can't find the cause, so to say, and we call it essential hypertension, we're left with the high sugar carbohydrate insulin thickening of the lining of each blood vessel. Do you know that insulin thickens the actual wall of your blood vessels and makes it more stiff? Yeah, and you can reduce that if you go low carb. Debbie says, hi, Dr. Rita, quick question. I think this is my sister. Yeah. Would you recommend I do EDTA chelation once a month? Have been doing the larger dose, 3,000 milligrams or 3 grams over a 3-hour plus IV. Do you recommend a lower 150,000 milligram over 1.5 hours? And my answer to that is we prefer the 1.5 grams of EDTA in the 1.5 hour infusion. And that's because very few people today have 3 hours to give. And the benefit of EDTA chelation is so prolific from head to toe. It is really an anti-aging phenomena to do. If you look up the TACT update 2019, Dr. Lamas, Lamas, that YouTube, if you pull it up, TACT, T-A-C-T, update 2019, Dr. Lamas, is only 15 minutes. He's the head of cardiology at Cedars-Sinai, and he will tell you about how he was resistant to chelation and then finally agreed to look into it. The National Institute of Health did the study, and that's one good thing the federal government and funds did that I'm aware of. And then the results were just fantastic. So he was so excited he got involved in Tech Trial 2 and Tech Trial 3, and they're all doing wonderful, prolific benefits for every part of the body, from your thinking and Alzheimer's to your toe fungus. So when you have chelation open up your microcirculation, that is what you need to do. Now, whether you do it on the highest maximum dose possible, which is 50 milligram per kilogram, and taking up to 3 grams and sitting for 3-4 hours at a time, that's up to you and your doctor. We here have found a beautiful kind of steady flying, level flying, where if we do a 1.5 grams and we do that once a week or over a period of time, once a month, 10 times a year, that we are staying ahead of the toxic heavy metal pollution that's out there. Dorothy asked the question, what is best cutting board to use for kitchen? What is the best way to clean it? I use glass jars to store my food. Well, you know, if you clean your boards after use all the time, the likelihood of no matter what board, if you're using these new plastic boards or your old-fashioned cutting boards or using marble surfaces, my answer is warm soapy water that is not leftover dishwater, just some good fresh warm soapy water. Taking a paper towel and putting your soap into it and squirting some warm sink water on it. That alone with all that rich soap, I let sink into my wood. I use the wood board. and then I put it under the water, and I run it for 3 passes. And most people consider that quite adequate, and I'm not going around culturing anything. So I just think your cleaning methodology needs to be consistent with warm soapy water. I don't think you need to get into caustic astringents or things like chlorine or bleaching. But I'm very prolific whenever I'm working with meat or chicken, fish, beef. I am always washing everything it touches and my hands between touching other things, so I'm not transferring the uncooked flesh of the protein onto other surfaces. So just warm soapy water is just fine. Dorothy also said, hello, for someone with Hashimoto's, can it ever be reversed holistically? And if not, is there a natural way to help the autoimmune system? Well, that goes back to, this is a question from Desiree. Yeah, so Hashimoto's is felt to be a autoantibody attack against thyroid gland tissue. There's predominantly 2 types. There's the inside of each cell conglomerate, the thyroid peroxidase, and then there's the tissue surrounding it, the thyroglobulin antibodies in these little vesicles that are making your thyroid hormones. And why does that happen? We don't have 100% consensus, and science is always about being able to openly theorize and discuss continuing studies on what may or may not be the cause. I think the most accepted and the one I've seen the most beneficial is that when we eat food that is genetically modified or glyphosated for insecticide resistance, and then you take it into your body, and it's seen by your immune cells lining your digestive system that has to break it down into absorbable nutrient packages, bring it through the membrane of the cell, and sort it out in its proper digested size into the lymph and bloodstream for absorption and direction to its needed site in the body. But if there are foods that are irritating to the lining of the gut, then it will harm the gut wall lining. That creates what we call a breach or leaky gut. And that leaky gut, therefore, is then associated with separation between cell. And that's what the zonulin markers are all about. But there's actually transcellular breaching through the membranes. That's what this picture is here. And that's often from plant food lectins, phytates, oxalates, and the like that are associated with allergic reactions or harm to the gut. Then the bacteria can leak through, and they're endotoxins. And then it's a never-ending circle. When you get that kind of immune challenge along the eating gut every day, common foods then that you consume or are marketed to you to consume repeatedly on a daily basis multiple times are highly likely to leak through. You make antibodies to it, and there's some cross transfer or mimicking genetically where it's misunderstood to be similar to the cell protein structures on other cells, which more than likely often are thyroid, because you have thyroid receptors on all your cells. And then you get what we call Hashimoto's. So then how do you treat it? You have to understand you can't listen to marketing. You can't be drawn by TV commercials, social pressure, even your mind thought of eating. We have to get a divorce from food as an entertainment or a reward. And we have to see food as a servant, as a replacement for damaged parts. So I don't think the mechanics in a car shop are rejoicing for every, tire that comes in, or gear, or, light bulb or fuse, but they see its usefulness because it provides them income in their repair, and they have a healthy income and lifestyle. So we should look at food, bringing the parts to our body that we need to it, and get away from prepackaged secret natural flavorings, labels that are obscure or you can't even read, that are full of chemicals that have not truly been established as safe. In Europe, there are many foods that we're commonly consuming in the United States that are banned there because of the things like our red dye is banned, I think, in Europe. Our genetic wheat is banned in Europe, and the list goes on and on. So that damages your gut. You're doing it because everyone else is doing it, because you don't see them drop dead immediately, but you don't understand they're hurting their immune system, which might have been useful in doing more screening and prevention of tumor and stem cells and killing cancer stem cells. So that's how you would approach it. Now, the phospholipids are rich in the diet of meat, fish, chicken, turkey, beef, eggs, things like that. And that is the double layer replacement for every cell membrane, not just your gut, but every cell in your body. And we would then say if you ate that way, you ate more simplistically, you ate in a concept of rules, a time restriction when you would eat and would not eat, so you don't eat late, which is harmful. If you would, swear off all packaged foods, all sugar drinks, and just commit to drinking water, or water and black coffee, or water and your tea. These are things that I think would be most beneficial. And then we give phospholipids and probiotics, a simple menu, a time-restricted menu. And then we recheck the thyroid antibodies about 2-3 months later, and we will always see if they will really do this and not cheat. And I mean, not be casual about it and lie that they really did do that when they really didn't do it. We see those antibodies come down dramatically. Leslie says hydrogen peroxide, our body makes it until a certain age. What is its function? Thank you. Well, these oxidants like hydrogen peroxide are part of our body's defense. We have lysosomes, vacuoles inside our cell membranes, so that when they phagocytize or they consume a bacterium, a virus, or a fungi, then this digestive burst from the lysosome can consume that invader. And one of them would be various enzymes and very high oxidatively stressful chemicals like hydrogen peroxide. So yes, we do make this. And as we age, all cell function begins to diminish. We bioaccumulate more damage if we don't eat enough phospholipid-rich foods. And that's primarily in meat, fish, chicken with the skin on it, egg yolks, and pork, and crustaceans, rich in the things that will repair this double fat bilipid membrane. And as they frightened us away from it, now they're changing their mind and saying these saturated fats. It's been stated by the American Heart Association quietly in their website as of 2015 that saturated fats are no longer felt to be the cause of heart disease. And so we go, what is called, the wisdom of science changes. There's the old joke in medical school that half of what you're taught is not going to be true 50 years from now. And that's a very true idiom. And that was said in my class in the 70s. And now the big scare on cholesterol back then, now they're denying it today. So we need to be open-minded and discuss these things and trust nature as long as we possibly can, and look to nature to give us some good teaching. I'm going to throw in a caveat here. I don't believe in evolution. I believe in a young earth, and I believe God made everything perfect and adequate until sin entered, and then destruction and death occurred. And then the confusion of the Babylon and the judgment, and then the coming of the Savior, and then the correction of this. And then we look for that blessed hope of our resurrection life. So when you say hundreds of millions of years ago, where's the proof? Show me the proof. This is not science. This is theory. And we cannot teach this as it is a fact. So you can believe in evolution, and that can be your faith. That can be your understanding, or what you consider as a secular religion, that we evolved from nothing in the Big Bang, and then turned into these molecules, and then cooled off, and then water miraculously formed, and then blobs of biological tissue evolved over hundreds of billions of years into slime and fish, and then animals, and then chimpanzees, and then us. You can believe all that, but there's no proof that can't be argued just as much by as many scientists that are censored in as many physicists, astrophysicists, astrologers, geologists, biologists, microbiologists, geneticists. All of these people, there are as many who believe in the young earth and have a good explanation for all these events that are listed in the scriptures, like the flood, and the meaning of the stars, and all that. So I want to tell you that you have to be open to discussion. We can declare what we believe, but I can't prove to you what I believe, and I can't always prove science. I can't always prove the diet that we're recommending, and it's going to take years and study and research and open communication. But we should always have our ears open and our eyes open and be learning. So this concept of hydrogen peroxide and killing off these bad things, viruses, bacteria, and the like, using high-dose vitamin C infusions actually produces some hydrogen peroxide that kills off these bacteria. But again, the argument as to whether it's an absolute bad thing, hydrogen peroxide, we have to understand even water can be a bad thing if there's too much. Salt can be a bad thing if there's too much. So the delicateness and the marvel of the human biology and system is to be glorified as a great creative event, way beyond some random chance, in my humble opinion. And so we'll have dangerous things like hydrogen peroxide, and we will have it under control. And that's why we need healthy membranes to keep these little chemical reactions in healthy packages. Denise said, "Hi, Dr. Ellithorpe. Thank you for taking my question. Do I need to take calcium supplement if I don't have any dairy in my diet?" The answer is no. And if not, is it needed to absorb magnesium I take for nocturnal leg cramps? That is not clearly necessary. We don't believe in taking exogenous calcium, little supplement capsules, because over the years, I explained, the calcium was recommended back in the 70s as 250 to 500 milligrams. And by the 90s, it was 500 to 1,000. And by the early 2000s, it was 1,000 to 1,500. And eventually, we were starting to see decades pass with no bone density increase by just taking exogenous calcium. Calcium in its biological form, which is absolutely massive and rich in eating grass-fed beef and fish and chicken and turkey and eggs and pork and shrimp and lobster and crab. All these have very good natural absorbable, bioavailable calcium. So we recommend it to be in your diet. Yes, it's available in fruits and vegetables to some extent. And the older we get, the more we have lack of healthy digestion. And so our nutrients become harder and harder to get, and our ability to fill these poked out holes in our cell membranes become more and more challenging. So we stress a phospholipid-rich, animal-based diet, and rich in all the minerals. There is no supplement that you'll probably need if you were on a all animal diet. fish, poultry diet. So that's what we think about calcium. And we have women gaining bone density here also with the vitamin K2, which the ruminant cow will produce eating the grass in her 7 stomachs. And that K2 is different from vitamin K1. It is not a blood thinner. K2 is very valuable in supporting as fat soluble vitamin the transfer of the calcium and vitamin D signaling its bone deposit in the appropriate places. It also is associated, there's good science saying, to mobilize it out of the tissues where it falsely got placed from chronic inflammation, like in the blood vessels. What can help reduce puffy eyes upon awakening? Well, she said she has a friend who uses a CPAP device, and you have to understand this device is made of plastics. You could have some low-grade sensitivities, but mostly the eye tissue, the skin around your eye, the skin and the blood vessels there is different from the skin right on your cheek and your arm, and it's very thin and porous, and so fluid when you are standing all day is draining, moving toward your kidneys to be excreted through urination. And then when you lay flat, the water equilibrates through the night. And so you'll get some of that water bioaccumulating in your skin and your brain. And then if you have compression to your face, some of that passage of that water will be inhibited. So that's the likelier cause of it. And then she described her husband gets dizzy when he lays down to sleep on his back. He never feels dizzy when he's upright, leaning over or leaning one side or to the other. What could be a possible cause of the dizziness? Well, benign positional vertigo is associated with, the typical spinning room, but you don't have to have a complete spinning room to have otolith stuck in one of your 3 loops of Helene. One is for each plane, and then the lateral diagonal planes. So horizontal, vertical, and then the diagonal. And you have them on each side of your head here with the endolymph in them. And it tends to get dried out with age as we don't drink enough water and we don't do enough exercise to do our hydraulics to keep it through and use enzymes to keep things moving along. And we eat too many carbs and it gets sticky. We become more diabetic with aging as we lose our muscle mass. So these are pathways to our death. And if an otolith got stuck in one of the 3 loops of Helene, you could have one plane in which you have that sense of dizziness. But I would have your husband see a doctor. It might be necessary to put him through a Barty chair and really swing him out. But one of the ways to promote that is to get your husband to drink half his weight in pounds as ounces of water, to go on a very extremely low carb diet for many, many, many days, to start walking or marching in place, and use systemic enzymes like Vitalzyme or Vascuzyme. Possibly do, if you can get them to EDTA chelation, that'll really help the microcirculation. And then the ENT and the Barty chair will almost work all the time. If that doesn't, then you, of course, need to go up in the scale and do an MRI of the brain and look at other causes, maybe vascular pathways. But that's what I would say. Dorothy asks, what is the best shrimp to get? I was told only to get jumbo shrimp because it's less toxic. Is that true? That's a myth. Shrimp is a bottom dwelling primarily, and usually the dirt and filth and toxins are going to land on the bottom of any water-based area. And that's the reason that they feel shrimp are not good to eat. But I'm telling you, basically the amount of toxins bioaccumulated by a shark or a tuna or these large fish consuming all these littler fish that are also bioaccumulating puts probably more toxin in the shark and the tuna, and most of us don't blink an eye at eating these things. So we're in a toxic world. We have to come to grips with that, and we have to start getting doctors to open up their mind to address toxins and irritants like that to our lifestyles to try and address these. So the mercury, for instance, EDTA chelation therapy is a broad chelating substance. Over the 40 years that I've been using it, I have always seen mercury go down. And there is a myth in the teaching that you can't get mercury out with EDTA chelation. That is a false statement. In fact, you definitely can. I've always seen it come out. That's why I use EDTA chelation, because it's the best studied, it's the oldest, it's the highest multi-decade usage, millions and millions and millions every year without any side effects. And yet it is a broad spectrum chelator of many toxic metals. So that's what I would suggest. Next question is Patricia. My 39-year-old son got a vasectomy May 20th. His pain slightly improved after 2 weeks, but then started getting worse. And he has a pea-sized lump right under the incision site that is causing him intense sharp pain and is extremely sensitive to touch. It is difficult for him to wear clothes and be mobile. The urologist said his ultrasound and blood work were all normal, no infection, and said the lump is something more like scarring. He's a firefighter paramedic and took off the last 3 weeks to lay in bed. The Epsom salt baths and rest still didn't improve him much. We are wondering if it could be nerve damage. Also wondering if he would need more surgery to correct this. So far, the doctor hasn't been able to give us answers. Have you ever heard of this type of pain 2 months after vasectomy? Yes, I have. What would you recommend? Well, this is one of the most immune reactive substances in a human body for men is their semen. So when they're doing a vasectomy, it's not uncommon to have a little tiny micro drop leak out at the site of the surgery, and it creates an intense autoimmune inflammatory response. And that you can Google it, the autoimmune response to a semen leak with vasectomies. And that is very much like, have you ever walked in the fields and the grass on a hiking trip wearing shorts and boots, and you get poked by some cellulose dead stick or weed, and it sticks into your skin on your leg or your shin, and a little tiny piece of that cellulose gets into your skin, your body will start making a fibrous nodule around that, and that'll stay as a bump lump on your shin all the rest of your life. Some people, it's irritant and very sensitive to the touch and brushing against it. So that's exactly probably what happened. And the doctor was correct saying it was a type of scarring. Yes, it's a fibrotic autoimmune reaction. And we would say you could cut it out and, do it under, clean surgical, medical doctor supervised management. And you could do a highly detoxing autoimmune type diet, which would be the carnivore diet for 2 months, 8 weeks. And then during that time, drink plenty of water and use high dose enzymes. Enzymes help to clean up the inflammation of any autoimmune or inflammatory process. And that's the direction I'd go and work with your urologist on that. Marilyn said, I miss TLC. I was a patient for many years before I moved out of the area, but still order from the TLC store. Well, Marilyn, thank you. I've been hearing a lot lately about the benefits of eating organ meat from grass-fed animals, not given hormones or antibiotics. What are your thoughts on this, and which organ meat is beneficial, how to prepare it? Thanks. Well, that's all true. Actually, it's well established that a vegan, all vegetarian diet will necessitate in time some deficiencies, and one of them in particular B12, zinc, protein deficiencies. And unless you can really learn to purchase vegetables that have balances in their amino acids and getting in the fats that you need, it is a challenge with those diets. So the most complete diet, I think the most simplest thing to do for busy people who can't plan out their diets, is to go carnivore if they have a serious problem or they just want to live healthy but live very highly nutritious without need of much supplementation, and that would be the animal-based diet, grass-fed. Now, a superior thing to do would be to have what they call these, hamburgers, where they pre-ground in a liver, kidney, heart as well, and you can get all that mixed into the meat of the hamburger. That is powerfully nutritious. I don't do that. I could get around to doing it. It's just I'm too busy. And the best thing I do is eat a carnivore diet and get liver in. Liver is my go-to for my organ meat, and I've always enjoyed liver, even since a little girl. And so I've been blessed with very, very good health and a very good cell structure throughout my body. So it's very hard to poke my membranes, destroy them, and get me susceptible to some invading toxin, virus, bacteria, or fungi, or toxin. But it's the best. Perimenopause, Nina asks, is perimenopause weight gain is very concerning. Plus 20 pounds. Nothing seems to work except cold turkey on carbs, sugars, and large caloric deficit. However, I still have an active lifestyle with sports and with little children and battling, finding energy. Always hungry, always craving sweets. What is the solution to the pounds while sustaining energy and being active? Nina, we're all different. We have different blood types. We have different stressors. We have different demands on us. Age matters, the age at which this is happening, whether you are on or off with natural hormone replacements such as continuous progesterone versus cycled progesterone, which would be 2 weeks out of the month you're on it with your estradiol. And so this is no easy question to answer, and it's one that's constantly evolving. Plus, to age is to stress. So the older we get, the stress of aging bioaccumulates. We're always trying to slow this down by exercising, doing muscle weight training to keep our muscle mass so it doesn't dwindle away our muscle mass. We're always trying to stay well hydrated. Even if we don't feel thirsty, we're trying to understand by discipline the value of water. We are trying to replace enzymes that we're not making like we did when we were younger. The effect of the stress hormone cortisol is becoming more and more dominant. Cortisol itself is a steroid, is associated with weight gain. Weight gain comes because it's perceived in a multi-dimensional biochemical pathway as stress, and stress always holds on to storage fat because the body thinks that you're very sick when cortisol is high, and that you're going to be in bed or won't be able to get food. Or it's, if you're like an animal, the animal is stressed when the cold starts and the cortisol goes up to try and turn all the fall harvest berries into fat for the bear to be able to hibernate for 3 months. So this is a multi-system issue, and that's why you see so many YouTubes saying, I have the answer, I have the answer. The fact is, good doctors are going to work with their patients. They're going to remind them that aging is stress. Stress is cortisol. Cortisol is weight gain. The loss of hormones is one of the things that propels us into aging and higher cortisol. So is it the natural hormone, or is it the cortisol that is going on? And is that being measured and checked by your doctor as well? And its precursor, DHEA. So I would say, Nina, you would want to look at many of these things with your doctor and talk about them. There are people, depending on the volume of exercise and the timing of their exercise and the amount of high intensity episodes and weight lifting, this all is variable to when you can have carbs or not carbs. And sometimes it's wise to have carbs. But I tend to think that there's enough biochemistry and research that exercise is best served on an empty stomach. especially if you want to mobilize fat out of the fat cells. And so I don't have a quick answer for you, Nancy, but there's a lot of black box stuff we can't say as a general patent rule for everyone. Harlow asks, my vitamin D level was 105 and my doctor said it was too high. That's false. It's not too high. And that I should cut back off my 10,000 a day with K2. I feel good. Should I be concerned? Well, if you are a patient, ask your doctor to do a vitamin D level at the same time you get your comprehensive chemistry done. A comprehensive chemistry is including your liver enzymes, including your bilirubin, including your protein levels, your immunoglobulins. And if there's no liver enzyme damage, then that vitamin D, which is fat soluble, if it's too high, it will irritate your liver and your liver enzymes will go up. So whenever you get a general, full, comprehensive chemistry, the doctor can look at the vitamin D alongside the liver enzymes. And if they're normal, I have some patients with liver enzymes that are perfectly normal and their vitamin D levels 150, 170. So that's foolishness. It's very fine. Estelle says, I've been purchasing topical creams, progesterone, and estrogen. I've developed thickened skin in my uterus and now undergoing a procedure in Europe that will be removing polyps. I was happy using your creams. It felt better with my back herniated disc. But here in Europe, they said my thickened walls in the uterus could be due to hormone taking. My questions, do hormones, can they be related to development of polyps and bleeding at my postmenopausal state that I'm going through now? And the answer is yes, Estelle. If you have a natural human female normal uterus, you can give yourself enough hormones that it will start, you'll start to menstruate again. And I cycle myself at 70 now, where I will have I use my progesterone 2 weeks on, 2 weeks off. I use it from the 1st to the 15th. So when I start to do that, that is the signal, just as if I ovulated like a young woman. And that'll start making any lining buildup from my estradiol that I use every day to clean it out, so that at the end, towards the end of 15 days of using it, that will generate a small, normal menstrual cycle. Now, I prefer that because I want to be regular and I don't want to build anything up and I don't want to have unexpected cycles of bleeding and I don't want to have ultrasounds or endometrial biopsies or DNCs. So your doctor, who's ever supplying you your hormones, should be checking your hormone level at least twice a year with the progesterone level and the estradiol, and then doing a pelvic once every year or two, and then occasionally getting a ultrasound of the pelvis, especially if there's any question of breakthrough bleeding. But you have a normal uterus. 9 times out of 10, this will be a normal endometrial response to healthy natural hormones. How do you think they can get older women to be surrogate mothers for their daughters who can't carry a baby but donate their eggs, and their mom is put on hormones so that the uterine lining will be built up, so that when she gets the implant of her daughter's egg to carry the baby for her, it's done with her having the uterus that has the rich lining. So yes, but your doctor has to watch this to make sure these are balanced. We like the progesterone at least 4 picograms or higher, and we like the estradiol high enough that you're not hot flashing, your mental acuity is sharp, you feel vaginally moisturized, you have less joint pain. That's why your disc felt better, because it helps with moisture absorption and lubrication of our joints. And I could go on and on. But yes, you have to have a good doctor that understands how to do that. Peter and Jamie said, what protocol and supplements can you recommend for a family of 4 to do a parasite cleanse? Well, their ages are 46, 45, 16, and 13. I don't know that you need a parasite cleanse. I would see a doctor who has the ability to do a complete digestive stool analysis and look and see if there's parasites. So I do hundreds and thousands of complete digestive stool analysis, and I could count on my hand over this place here 23 years, maybe on one hand, maybe on two, where I have seen a parasite out of the hundreds and thousands. So do I think everyone needs to do a parasite cleanse? No. What might be a valuable thing, you could use the orthomolecular's intestinal and what's the other name of the other product? Yeah, Candicid forte. And ivermectin is a cleanse. Grapeseed extract is. Caprylic acid is. But I'm saying, to what end? To what purpose? I'd rather see you spend your money on good amount of vitamin D, get a lab for checking that, get a EDTA chelation, because we know we all are exposed to heavy metals. So I don't support just the concept of a random parasite cleanse. I actually think a lower carb diet, spend some money on some good steaks, and that would be far better. T says, do you have recommendations for products for high cholesterol and artery blockage? Again, it's the low carb diet. We are literally being killed with fructose, glucose, galactose, sugar in our drinks, sugar in our packaged long-term storage life packaged foods, our cereals, our rice, our beans, our pastas, our treats, our drinks, our smoothies. We're turning all this into bioavailable, juiced and smoothied up plant foods and fruits that make the sugar way too bioavailable. Cut that down and you'll see cholesterol come down. Now, I don't mind high cholesterol. There is a YouTube by Dr. Ken Berry and the PhD professor David Diamond. And the name of that YouTube is called High Cholesterol is Healthy. I would ask you to watch that because this was done in the last 3 months, and they did a nice review of all the recent literature on cholesterol and the recommendations for being on statins and so forth. But if you want to know the main thing to do, cut those carbs severely down. Don't eat anything that's packaged. Eat a whole food, natural diet, and exercise, and do some chelation, because that will improve the microcirculation and take systemic enzymes that'll help clear up microclogs. Don't eat late at night. Have a time-restricted eating time. Yes, there is bergamot, which is a special fruit that has anti-cholesterol and cholesterol-lowering effect. And red yeast rice is how they developed the very first Lipitor statin. You could take red yeast rice. But what you need to do is don't spend money on that. Buy a good steak, exercise, or get a gym membership, drink water, and don't eat after 6 o'clock. Do intermittent fasting. Joanna says, are there dietary changes that can be made to get rid of spider veins on legs? The answer really is no. I mean, to have the best health, you want to do all the things I just told you to do with the low carb, exercise, not eating late, enzymes, EDTA chelation, and eating the foods that help make up healthy membranes, because healthy, thick skin also is benefited by having natural hormones, so you don't get thinner and thinner on your skin thickness. And there's tremendous amounts of collagen and material that will help keep the cell membranes there so these little veins don't emerge with thinning skin with aging. I have seen people get blood clots after the sclerosing agents they've injected in spider veins. So I am not ever going to recommend that for a patient. Put a pair of leotards on and cover them up. Eat a low carb diet, exercise, and put some, beige makeup on it if it's. But if it's tremendous, of course, go see a vascular surgeon. There may be some new breakthrough that I haven't heard of, but I doubt it. Julie says, hello, for almost 9 months, I've been treated for mold, fungus, yeast, and bacteria. Although I eat very well and follow the detox supplement and mitochondrial diet protocol as requested, the process seems to be endless and would like to know how you would treat this challenge and consume at least 5 ounces of homemade kimchi, sauerkraut every meal 3 times a day, because fruits, grains, and milk products feed the health challenge. I eat no more than one fruit, one grain per day, and consume no milk products due to my weight at 100 pounds. I don't want uh, I don't want to lose any more weight. I also keep the body moving daily, walking 100 miles a month, as well as a ground earthing. She does grounding, standing in the earth, and I use my Rich Way biomat daily. Thank you. Look forward to your comments. Everything that I've told in the prior answers, such as eating a low carb diet, getting the healthiest elimination diet for building your body is the carnivore diet. I would literally, there's a book out there called Carnivore Cure, and it is by Judy Chow, Chow. Now, she's not a medical doctor. She is a nutritionist. There are mold case stories in there. And of course, you do the home remediation, getting the plants out and getting the carpeting out and draperies, and have someone look for water damage in your house, these kind of things. But if you've done all that, I would go on the carnivore diet. It is the most amazing thing for a doctor to see a single menu for people. Find out your blood type. If you're a blood type A, you've got to use digestive enzyme to help you with digesting meat, fish, chicken, pork, eggs, and so forth. And I would use lots of enzymes. And we use the vitamin D with K2, and we use a multi-mineral. And our antioxidant we usually use is Juice Plus, the fruit, vegetable, and berry that has all the starch and fruit sugars out of it. It has all the phytonutrients in it. And then lastly, a good probiotic. I would see a good doctor, functional doctor, who could do a complete stool on you, do an iodine level on you, do your minerals on you. EDTA chelation can pull toxins out as well that way. And the yeast should diminish very clearly that way. Mercury will be removed, and so forth. That's where I would begin, Julie. Melissa says, is it okay to take DHEA if you have breast cancer? Yes, the answer is yes. What supplements do you recommend for fatty liver? I really recommend the low carb carnivore diet. You can use berberine, alpha lipoic acid. These help with you lowering your blood sugar and the fructose. Remember, sugar is a glucose fructose peptide, disaccharide. And these fructose is like taking alcohol into your liver. And we are at a massively high, we're so full of carbohydrates in this country, we don't even realize how many carbs are coming at us every way. So that would be the first thing, and exercise. And then you could use alpha lipoic acid, 500 milligrams twice a day. You could use berberine, 500 milligrams twice a day. That is what they made metformin off of, so it will help you lower your blood sugars more quickly. Exercise will help you do that. Enzymes, systemic on an empty stomach twice a day will help you do that. And never eating late, and just staying away from those carbohydrate and sugar drinks. And her next question was, do you recommend berberine for high blood sugar? The answer is yes. Do you ever recommend berberine, or do you have different supplements to recommend? No, I use the berberine. What do you do? What do you recommend for osteoporosis? Natural hormone replacement therapy monitored by your doctor twice a year with pelvic ultrasound if needed, and doing the vitamin D with K2 to get your vitamin D levels up to at least 80, if not 120. Is it ideal okay to take thyroid if symptoms of Hashimotos are present and labs should suggest Hashimotos? Yes, many patients are on natural thyroid glandular every day, and they still have their elevated thyroid peroxidase antibodies and thyroid globulin antibodies. And as they're healing their gut with the phospholipids from a more carnivore animal-based diet, or taking a phospholipid powder like our phospholipid powder here, it always improves. And then finally, Mary says, hi, Dr. Ellithorpe. I enjoy your question and answer program on YouTube. My question is, I'm 77 years old, female, who has a prolapse of the uterus and bladder, stage 2 and 3. What do you consider to be the best treatment for such a condition? I'm very active, eat low carb, and exercise. I want to continue lifting some weights, but I'm afraid to do so at this time. I've never been on hormone replacement. Mary, I think it'd be very smart to go on hormones, especially you could use vaginally some estradiol or estriol. Estriol is very benign, and mix it with some testosterone to get more thickness and structure in the cell structure there to help prevent the bladder from coming down along the lining, unfolding, ripping down the lining of the vaginal canal. There's pessaries you can put in there, and they do much better if you're on some natural hormone replacement as well. Yes, I think that would be very important to do. And then, of course, see your urogynecologist, whether or not you have to use a surgery or not. And I would still use hormones even then. Last page is Frank, my primary care physician, explained the atherosclerotic coronary vascular disease risk calculator to me. My risk evaluation puts my 10-year risk of atherosclerotic coronary vascular disease at 8.1%. The recommended treatment for this risk is to be put on a statin treatment. Do you have a position on statin regimens, or do you recommend alternative treatments? Thank you. Well, I would tell you to work with your physician and to ask him to watch the YouTube High Cholesterol is Healthy by Dr. Ken Berry and Dr. PhD Professor David Diamond. They're reviewing the latest literature. I would ask you to ask your doctor to find out what the side effects are and discuss the percentage risks ratios there, and that's what's on that video. And that far exceeds the 8.1 risk of heart disease development. I would richly ask you to look at information on a low carbohydrate diet, which will help lower cholesterol and reduce your triglycerides and your increase your HDL, and do those lifestyle changings much more than a statin. So watch Ken Berry, Dr. Ken Berry, a family practice doctor, and Professor Dr. David Diamond on Ken Berry's YouTube series called High Cholesterol is Healthy. And then Narja says, is it okay to take ashwagandha while on NP Thyroid? Thank you. Definitely it is. You know, your NP Thyroid, has to be dosed daily. The peak of its energy is in the morning for metabolism. Ashwagandha is a calming herbal agent associated with calming of the brain, the mood, and it is very valuable to be dosing with this in the evening or the mid-afternoon. So yeah, they're quite safe together. Now let's see. Robert Pinsky has a joke, so we got to get that in for Robert. He said, if you soak rooster feathers in a glass of water, what do you have? A cocktail. Oh, is that cute? If you soak rooster feathers in a glass of water, what do you have? A cocktail. Okay, Robert. Speaking of cocktail, I take SBI Protect, GlutaShield, Ortho Collagen, Orthobiotic Powder, and BioPC Pro each morning. That's a powerful powdered mixture of healing the lining of your gut, improving your immune system, improving your ability to build new cells with exercise, have a better brain, better eyeballs, better blood vessels, and so forth. So good for you. I have a joke for you, Robert. What do you call a chicken that stares at lettuce? What do you call a chicken that stares at lettuce? A chicken sees a salad. A chicken sees a salad. Very good. I'll take a bow. And then the last one, Joanne said, is there long-term effects from taking synthetic vitamins such as vitamin D3? These are studies, Joanne, that need to be done. I'll tell you, practicing and my dad in food research, I've been around vitamin arguments for since I was probably 4 years old. And so that's 66 years, okay? And I tell you, there have been some pilot studies done where they've done random sampling of various locations to pick off glycosamine sulfate, and some bottles didn't even have it in the bottle. So what else do they do? And this is a most essentially unregulated field, which is the supplement area. So could they use fillers? Could they make the capsules out of it? God only knows. Therefore, to have reproducibility and some sense of control, because I don't think you need wild, crazy, large supplementation out there. I have my own little nutrient pharmacy where I'm testing clinically on my patients all the time to find out if given, does it work? We sample it clinically. It's associated with clinical improvement and laboratory efficacious levels improved and the downstream biochemical pathways. So that's the dilemma, Joanne. I wish I could give you 100% answer, but it's just generally been a wild west out there. And unfortunately, a lot of people do this just for the money. So again, if you like this, please like and subscribe. Please share this with a family or friend. And may God bless you and stay healthy and take care of each other. The greatest healthy thing you can do is to care for someone else. All right, God bless. Bye-bye.